about these booster shots, and what's the likelihood that Americans are going to need one?
Great question, and thanks for having me this morning. You know, my immune-compromised patients, my patients who are older, my patients who have underlying health conditions probably would benefit from an extra dose to boost the level of antibodies that are parked in their nasal passages to fight off this more contagious Delta variant. So I think it does perhaps make sense. But of course, there's a lot of nuance here. It depends on the patient. It depends on their clinical situation. So the last thing we want to make people think that just because we're talking about a third shot means that the vaccines aren't effective. We have to remember that these vaccines are stunningly effective at preventing the severe outcomes from COVID-19, even with Delta in circulation. When you get vaccinated, you're protecting yourself and those around you because you are less likely to transmit the virus when you are immune to COVID-19. Masking, I think, should be optional for people who want to. If they are immune compromised, at high risk, even if they're vaccinated. But I don't think necessarily that we should have a mandate because, one, that undermines confidence in these extraordinary vaccines. It helps undermine people's desire to get vaccinated when they think, hey, why should I get vaccinated if I have to mask up again? But, of course, if people want to mask up, they should be allowed to. That is our choice. That is our right. And certainly unvaccinated people should mask up in public because they are at the highest risk for COVID-19.